Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us once again for Health Professional Radio. In this segment, we're going to be speaking with Dr. Flavia Hoyte. She's joining us here from National Jewish Health in Denver and also from the University of Colorado Hospital in Aurora, Colorado, to discuss ProAir Digihaler System. A clinical study in asthma management was conducted. The Connect 1 clinical study, the first ever to evaluate ProAir Digihaler. Welcome to Health Professional Radio, Dr. Flavia Hoyte. Thank you for joining us.
Thank you for having me.
Well, tell us a bit about yourself and your role at both the National Jewish Health in Denver and at the University of Colorado Hospital in Aurora.
Sure. So I'm an associate professor of allergy and immunology. I am based at National Jewish Health, but I have an academic appointment with the University of Colorado. And I am the program director for the Allergy and Immunology Fellowship Program. So I've been in academic practice since about 2011. Mm-hmm. All of which has been at National Jewish and the University of Colorado.
What prompted you to go into immunology?
Yeah, so immunology, I think, is fascinating and a very interesting and growing field, which impacts, I think, pretty much the body from head to toe. So I focus mainly on the airway in regard to this project, but in practice, I treat patients with all sorts of allergic and immunologic conditions, and it really keeps me on my toes.
Asthma management. I think we're all aware of, we've all known someone who has suffered with asthma, maybe severe asthma, maybe a little bit of asthma. Tell us exactly what asthma is, how prevalent is it, and who's affected?
Yeah, so asthma is very prevalent. It's probably the most prevalent condition of the airways. And who's affected? Anyone from very small children to older adults. The thing about asthma is it's not just one condition. It's very heterogeneous. So you have patients who only have problems when they go for a run or when it's allergy season. And then you have some patients with very severe asthma who have daily symptoms and are in and out of the hospital. So really it affects a lot of people. And I think the biggest morbidity and mortality comes from the more severe asthmatics. And, it's a chronic condition, so medications need to be taken on a regular basis to help control asthma. And there's a great partnership between the provider and the patient in terms of making sure that the controller is being used, and if it's not enough, that we escalate therapy. And that's where this kind of monitoring that we looked at in this study can be very helpful.
Is it common or is it a myth that a child with asthma can possibly grow out of it and never suffer from it again after a certain age?
Yeah, that's a good question. So it is true that children can outgrow asthma. It's very unpredictable as to who will outgrow asthma. And sometimes in late adolescence, early adulthood, the asthma seems to have gone away, and then sometimes it comes back. So I think what's more common is a very small child that will have wheezing with viral illnesses and then doesn't end up developing asthma. And so we use a lot of caution in identifying a patient with asthma before the age of 5. We just are very careful not to label them until the disease declares itself.
Now, before we get into the Connect 1 study, what is the traditional go-to treatment for asthma, whether it be severe or mild?
Yeah, so there are two types of treatments. There's, again, the controller therapy. So that is something that you're going to use on a regular basis to help control the inflammation and the closing up of the airways, the bronchoconstriction. And then there's the reliever medication, which is something that you use when you're having symptoms, or if you're about to do something that you know is going to trigger symptoms. So, for instance, I gave the example of exercise earlier. You can pre-medicate for exercise with a reliever inhaler. The classic reliever inhaler is a short-acting beta agonist. So it acts quickly. It acts for 4 to 6 hours and opens up the airway. And then the classic controller inhaler, and there are several, but there you're really trying to target the underlying problem in asthma, which is inflammation. So the classic controller medications are going to generally be inhaled corticosteroids. And more recently now there are several biologic agents. So in the more severe patients, we're targeting inflammation kind of earlier in the pathway of inflammation with these biologic agents.
Tell us about the ProAir Digihaler System and the Connect 1 clinical study evaluating that system, if you would.
Sure. So the ProAir Digihaler is made by Teva, and I was fortunate enough to partner with Teva and several fellow pulmonologists and allergist immunologists to lead this trial. So the ProAir Digihaler is an integrated inhaler that pairs with two different things. So one is the patient-facing app on a smartphone, and the other is a provider-facing dashboard. And the system records objective information that's accurate. In this case, we were looking specifically at the ProAir Digihaler. So we were looking at ProAir, which is a type of albuterol or short-acting beta agonist. So again, that reliever inhaler, and looking at how often patients are using it and also their technique. So the Digihaler is able to measure how good of an inhalation a patient is taking when they're using the inhaler to see how effective it might be.
So if the patient is not inhaling correctly or enough, then their physician is aware of that and can advise them accordingly?
Yep, and not just the physician, but also the patient. So the patient will get an alert on their app that says, you didn't breathe deep enough. So they're knowing that they're not getting a good enough breath, and that will trigger them to maybe breathe differently or maybe make a phone call to their physician to say, hey, my app keeps telling me I'm not breathing right. Can we make an appointment to make sure I'm using this correctly? And then on the physician side or the provider side, you can see, again, is a patient using their rescue inhaler 10 times a day? Well, that's a problem. We usually aim for twice a week or less. So either too much or a change. So they're using it twice a week, and then all of a sudden this week they're needing it 20 times. That's an alert to the physician that something's going on. And then again, the technique, we'll see, wow, they're not hitting the right inhalation multiple times. This needs an intervention now. Otherwise, they're not getting the medication that they need.
What do you think the major takeaways were from the Connect One study?
Yeah, so this study was the first one to, as you mentioned, to evaluate the impact of this Digihaler system. And we looked at children aged, 13 and older with uncontrolled asthma. So already starting out with uncontrolled asthma and seeing if this Digihaler worked any different than just the standard of care albuterol inhaler that was not giving feedback to their phone and not giving feedback to the provider. And the ProAir Digihaler and its integrated system actually had an 85.3% probability of higher odds of improving asthma control in these patients. And we also saw that there was an increase in interactions between the physicians or providers and their patients based on the information given through this Digihaler system. So a lot of these interventions and interactions were based on either poor inhaler technique or an increase in the short-acting beta agonist use.
I'm not sure if I heard you when you were talking about the percentage of probability of higher odds improving their asthma control. What time period were we talking about in this study?
Yep, that's a great question. After 3 months.
Oh, okay.
So we had half the patients essentially use the Digihaler system and half just use the regular albuterol inhaler.
So I guess a marked improvement in controlling. Was there any information about frequency using this inhaler?
So the medication itself was the same. The medication is albuterol, which is the same between the Digihaler system and the albuterol, just the standard of care. Mm-hmm. So it wasn't necessarily a tax, but the amount of use was actually decreased. So the amount of short-acting beta agonist use decreased, which is a marker of better control generally. Okay, yeah. The more you're using, the worse control it is generally. And then if you look at days without needing it, that also improved in the group using the Digihaler system.
So basically, the Digihaler system allows for better communication between the patient and their physician, and also allows them to be smarter about their own use of the Digihaler, correct?
Yep. I think the word smart is a good one to use there. So it's a smart digital health product, and it's giving patients that real-time information, that accurate information, and those interventions can be made earlier instead of waiting until that next scheduled appointment. And do you happen to remember to ask the patient how they're using it? Does the patient happen to remember to ask you how to use it? You don't have to wait for all of that. You see the information real time, you act on it. And this study shows that it really makes a difference.
Well, give us a website where our listeners can learn more.
www.digihaler.com can give you more information about this.
And that is Digihaler, Digihaler, all one word, .com, correct?
That's correct.
Great. Dr. Hoyte, I appreciate you joining us here on Health Professional Radio and giving us this information. Looking forward to our next conversation.
Thank you. Thank you so much for having me, and I look forward to that conversation as well.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe and download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.